Imagine waking up one morning with a burning fever and a leg so swollen you can barely walk. You don't know what's causing it. You just know it's getting worse every hour. In 2025, you open your phone, book an appointment, and walk out of a clinic with antibiotics. 10,000 years ago, you called for Thok. Thok was not a doctor. He had no certificate on the wall, no stethoscope, no database of known diseases. But Thok was the most respected person in the village, sometimes more powerful than the chief. He was the healer, the shaman, the one who had seen this before and kept people alive. And the things he would do to you would be surprising in ways you don't expect. Let's start with that fever. Thok doesn't panic. He walks to the willow tree at the edge of the forest, strips the bark, and hands you a cup of bitter liquid. You grimace. You drink it. Your fever drops. Willow bark contains salicin, a compound your body converts directly into salicylic acid, the active ingredient in aspirin. When chemists finally isolated it in 1829, they thought they had discovered something new. Thok had been prescribing it for thousands of years. This wasn't unusual. Plants contain chemistry that humans learned to use long before they could explain why it worked. The Ebers Papyrus, an ancient Egyptian medical document written around 1550 BC, lists over 700 plant-based remedies: garlic for infections, castor oil as a laxative, aloe vera for burns. We still use all three today. Ancient healers didn't know what an antibiotic was, but they knew certain molds on bread kept wounds from becoming fatal. In 1928, Alexander Fleming discovered penicillin by accident on a petri dish he had left by a window. Ancient Egyptians had been pressing moldy bread onto infected wounds for at least 3,000 years before that. Across the Atlantic, indigenous American peoples had built a completely independent pharmaceutical tradition. The bark of the cinchona tree was being used in South America to treat the cyclical fevers we now call malaria. The active compound is quinine. It remained the primary treatment for malaria well into the 20th century. When Spanish colonizers arrived and started dying from tropical diseases, they often had no choice but to rely entirely on indigenous healers to survive. The knowledge that saved European lives in South America had been refined over thousands of years by people those same Europeans assumed knew nothing about medicine. Not everything Thok would do was that elegant, though. If you had a headache that wouldn't go away, the crushing kind, with flashes of light and weeks of pain, he might suggest trepanation. That means drilling a hole in your skull with a sharpened piece of flint. Archaeologists have found over 1,000 trepanned skulls on every inhabited continent, some dating back 9,000 years. The oldest ones were found in France. In Peru, surgeons were so skilled they performed the operation on multiple patients. The astonishing part isn't that they did it, it's that many of those skulls show bone regrowth around the edges of the hole. The patients survived. Some had the procedure done more than once. You were probably not fully unconscious during the operation. They may have given you fermented drinks, or plants like datura, which causes a deep dissociative state that makes pain distant and time-elastic. The surgeon scraped slowly and carefully, using stone tools ground to surprising sharpness. We believe it was used to relieve pressure from head injuries, to treat epilepsy, or to release whatever was believed to be causing the suffering. Whatever the reason, the technique was refined over generations because it worked often enough to keep repeating. Ancient Egyptians went even further than herbs and drilling. A papyrus from around 1600 BC, the Edwin Smith Papyrus, describes 48 surgical cases in extraordinary clinical detail. It tells you how to examine a wound, how to close it with sutures, how to splint a broken bone and immobilize the joint. It doesn't invoke gods. It doesn't prescribe prayer. It simply says, if you examine this patient and find these signs, do this. That structure, observation, diagnosis, treatment, is precisely how modern medicine works. This was written 3,600 years ago. In ancient India, a physician named Sushruta was practicing surgery around 600 BC. He cataloged over 300 procedures and 120 surgical instruments: forceps, scalpels, needles, probes. He performed cataract surgery by displacing the clouded lens from the visual field using a curved needle. He reconstructed damaged noses using skin flaps taken from the patient's own forehead, a technique modern plastic surgeons still call the Indian method. The instructions he wrote were so precise that European surgeons were still referencing them more than 1,000 years after his death. In China around 200 BC, physicians developed acupuncture, inserting needles at specific points to restore the flow of energy they called qi. For centuries, the West dismissed this as philosophy dressed up as medicine. Then modern neuroscientists found that many classical acupuncture points correspond exactly to nerve junctions and connective tissue planes that genuinely influence how the body processes pain. The theoretical framework may have been wrong, but the observations underneath it were real. Ancient Romans understood something that would elude Europeans for over a millennium after Rome collapsed. Clean water saves lives. Roman aqueducts delivered fresh water to cities of 1 million people. Roman law separated drinking water from sewage disposal. Cities with these systems had dramatically lower rates of typhoid, cholera, and dysentery. When the empire fell, the infrastructure was abandoned, and disease rates across Europe rose almost immediately. It would take until 1854 for a London doctor named John Snow to prove that cholera spread through contaminated water, not through bad air. Thok understood the principle of keeping the sick away from the healthy. He just didn't know about bacteria. Now imagine walking into Thok's space for the first time. The walls are hung with dried plants and bundled herbs. The air smells of smoke and something sharp and medicinal. He asks you about your sleep, your dreams, your food. He looks at your eyes, your skin, your tongue. Then he mixes something carefully and watches you for the next hour. Before you leave, he tells you, rest for 2 days. Drink this every morning. Avoid cold water. Come back if the swelling spreads. He has seen this before. He knows what usually happens next. This is not so different from what a careful doctor does today, minus the equipment. Here's what surprises most people. Ancient healers were often more effective than licensed doctors 2 centuries ago. In the American Civil War, hospitals were one of the most dangerous places a soldier could be. Surgeons moved from patient to patient without washing their hands or changing their instruments. More soldiers died from infections acquired in hospital than from their original wounds. The germ theory of disease was still being debated. In 1847, a young doctor named Ignaz Semmelweis was working in a maternity ward in Vienna and noticed something strange. Women in the ward attended by medical students died at 5 times the rate of those attended by midwives. The only difference was that the medical students came directly from performing autopsies before delivering babies. Semmelweis ordered every doctor to wash their hands in chlorinated lime solution before entering the ward. Deaths dropped by 90% within weeks. His colleagues rejected his findings. He was mocked, fired, and eventually committed to a psychiatric institution where he died at 47. 20 years later, Pasteur and Lister confirmed germ theory, and the world finally understood what Semmelweis had already proven. Ancient medicine was not guesswork. It was careful observation accumulated over tens of thousands of years and passed down through an unbroken chain of teachers and students. The healer who kept patients alive gained status, reputation, and apprentices. The healer who kept killing them did not. That is selection. That is how knowledge refines itself, even without journals or universities. The next time you take an aspirin, you're standing at the end of a chain that begins with someone chewing willow bark and noticing their pain eased. They told someone. That person told someone else. That knowledge survived famines, floods, migrations, plagues, and the collapse of entire civilizations. And it reached you. Thok didn't know what salicin was. He didn't need to. He knew it worked. And for 10,000 years, that was more than enough.